I need to see a psychiatrist now.
Don't listen to my husband, Ben. You're being ridiculous.
Sir, you need to wait for triage.
It's okay, Leah. Hi, I'm Dr. Charles. How can I help you?
Listen, I need to check myself into the psych ward.
No, he doesn't. He's not crazy. Ben, please. People are listening.
Do you think I care? I need to be committed for as long as it takes to stop these thoughts.
Okay, I understand. How about if we step into this room over here so we can discuss your situation?
No more talking. I don't need to talk. I need to be locked up.
Ben.
You send me back out of there, then I'm going to murder my wife. Shortly after my wife got pregnant, I started having these thoughts.
Okay, take your time.
It's all right. No one here is judging you.
I'd imagine killing her, slashing her throat with a knife, to be specific. I can't even be around knives anymore, afraid of what I might do.
It must be terrifying. Can I ask you, was this pregnancy planned?
Yes, no. We both wanted it. I don't have an escape fantasy. I'm not jealous of my unborn child.
It sounds like you've been seeing some other therapists.
Two. One wouldn't even be alone in a room with me. Thoughts only got worse after that.
I'm really sorry you had to go through that. You know, sometimes when we overfocus on fixing problems like this, not thinking certain thoughts, it tends just to tighten their grip.
Like if I tell you not to think of a brown bear, you'd immediately picture it.
Look, I'm telling you, I'm a real danger. I need to be committed.
It seems to me that Ben is suffering from some sort of OCD. Other than that, he has no functional impairments.
We're not talking about overwashing your hands here or checking the front door every 2 minutes. This is OCD harm. His thoughts toward his wife are violent.
Judging from Ben's history, there's no reason to think he would act on it.
We don't know that. I mean, what if we send him out here today and he does? I really think that committing him is our best option. Put him in an environment where he feels safe from his thoughts, help him diffuse them, or at the very least, coexist with them.
What if the right move isn't to make him feel safe from his thoughts? What if it's to make him confront them directly?
You mean exposure therapy? Dr. Reese, I know that's been very helpful to you, but in this case, that approach would be extremely risky and way too early. We need time to fully evaluate the patient. Okay, so let's commit him to the psych ward and take it from there. Okay?
Have a seat, Ben.
Wait, have I been committed already? Shouldn't I be medicated or in a straitjacket or something?
So the nurse is preparing your admittance paperwork, but in the meantime, I would like to talk to you about something.
Talk about what? I already told you. I've done every type of therapy in the book. The thoughts won't go away.
I understand. But what if I told you that most of the thoughts we have are just nonsense? Just synapses popping off in our heads, and that we shouldn't take them so seriously? If you could, just do me a favor for a moment. Close your eyes. Now, I want you to bring up the thought that frightens you the most. Tell me what you see. It's okay. You are in a safe space.
I see myself. I'm holding a knife.
Keep going.
I see my wife. She's in the kitchen doing dishes. I'm walking up behind her. She doesn't know I'm there.
You're doing very well.
What's that?
I paged Dr. Charles. Let me know when he comes up here.
Kayla, I got your page. What's up?
It's Dr. Reese. She's locked in with a patient.
You've conquered your fear of holding a knife. A weapon. Now imagine that I'm your wife.
can't.
You can. I trust you. Do you see her?
Yes.
Here's your opportunity. You can slit my throat right now.
No. I don't want to. I don't want to do it.
No, you don't.
This whole time you've been beating yourself up over your thoughts.
The fact that you can't dismiss them does not mean you're depraved. It shows you have a conscience.
Dr. Reese, outside, now.
Dr. Charles, I know I didn't take your approach today.
Didn't take my approach? You directly defied my orders and put yourself and your patient in real danger.
Ben isn't dangerous. I think I just proved that.
The only thing you proved to me is that you're reckless and insubordinate, and I have half a mind to suspend you again.
The last few months, you've been preaching to me that I can either see my patients as a threat or as an opportunity. Was I afraid in there? Yes. But my fear no longer controls me. I control it, and now Ben controls his too.
You are missing the point. I appreciate that exposure therapy has given you a newfound sense of confidence, but it does not make you all-knowing and invincible. What you just did in there was unbelievably stupid.
Tom Lyons, 25, collapsed in the stairwell of this building. GCS 15, BP's low at 88 over 55. Even after a liter of NS, heart rate's 97 and SAT's 100%.
Hi, Tom. I'm Dr. Halstead. What's going on?
I fell.
Oh, yeah?
Isn't this all a bit much?
I'm just gonna check you out and make sure you're okay. On three. 1, 2, 3. Thanks, guys.
Yeah.
Your lungs are clear. CBC, CMP, tropes, and an EKG. Also chest x-ray and sticking for glucose.
On it.
Really, I'm good.
Yeah, not sure why his pressure is so soft. Let's fast his belly. Okay.
Yep.
It's okay, get it out. Tom, you with me? Get it out.
I'm feeling much better.
Good.
I think I'm ready to go home.
Is this necessary?
We haven't met. I'm Dr. Halstead.
Kirsten.
And you are?
She's my girlfriend.
I see. So, Tom. Unfortunately, your test results show you're in acute liver failure, which is causing bleeding in your stomach.
Can we go now?
No, Tom needs to be treated. If not, he could wind up in end-stage liver failure.
End stage?
Be quiet. Treated. What exactly does that entail?
Well, for starters, I need to run some more tests to find out what's causing the liver failure.
No. Unhook him from all of this. We're going.
Oh, wait a minute. Tom? What do you want?
We'll go.
I want to leave.
I strongly advise you not to.
Let's go, Tom. Get up.
Hold on. Before you can leave, you have to sign an AMA form.
Then get it.
What's the worst that could happen? I die?
Well, if you leave, it's a very real possibility.
Shut up, Tom. Get up. We're going.
Whoa, hey. Tom? If your liver fails, your brain will deteriorate. Your entire body will swell up, and you will most likely bleed into your stomach again.
And that will kill you.
But I'm already dead.
Tom, don't.
I'm a vampire.
Okay, hold on.
Get out of our way.
I can't do that. I gotta keep you here at the hospital. I'm putting you on an involuntary psychiatric. Hey!
Let me see it.
Go get them.
Security! Stop them!
Come back here! Oh, stay right there.
Whoa! Get him out of the sun!
I treated with Silvadine.
Yeah. This is why I wear a hood. Vampires can't be out in the sun.
Tom, there are medical explanations for why this is happening to you, and I can figure this out if you just let me take another blood sample.
So you can experiment on me? This is exactly what Kirsten said you do.
What did she tell you, Tom?
That you parade me out in the news claiming to be the doctors who discovered and cured a vampire.
No, we're not gonna do that. We just want you to get better.
As a vampire, I get to live like a god. Long after you become worm food, Kirsten and I will just be starting our next chapter together.
Look, Tom.
Will, can I get a minute?
What is with this kid?
Look, he's submissive, he's impressionable. She's essentially brainwashed him. As far as he's concerned, he's a vampire. Trying to reason with him, it's a waste of time, could even be counterproductive.
Fine, but he's on a psych hold. Can't you medicate him?
Not unless he becomes acutely dangerous or we get a court order.
He vomited a pint of blood this morning. He's going to bleed again, and it will kill him.
First of all, Tom, I would like to apologize. Clearly, you are a vampire. It's just that we've never treated one before, and so it's our mistake. And I'm sorry. You must be getting hungry. Would you like me to contact the blood bank?
You're messing with me. It's just like Kirsten said. Doctors can't be trusted.
Oh, yeah, Kirsten. Where is Kirsten? Is she out in the waiting room?
No.
She left.
Tom, do you mind me asking, how long have you two been together?
8, 9 months.
I'm just curious because, well, I mean, if you forgive me, it seems like she kind of abandoned you.
She had to.
But to the very people who she said were so dangerous?
You chased her away. She'll come back for me. Tonight.
Well, hopefully, but I mean, even if she does, doesn't it kind of bother you a bit that, I don't know, that she put herself first? I think you deserve someone who puts you first. You know? I mean, someone who loves you. Because if Kirsten did, I mean, I don't know. Why didn't she hear?
Hey, give us a chance to help you. Let me run some tests. Hey, Tom? What can I do for you?
I'm not feeling good. I'm sick.
Yes, you are. And I can help, but only if you let me.
I've been texting Kirsten. She's not answering. When I call, it goes straight to voicemail. I think she blocked me. She's not coming back, is she?
I'm sorry.
I never felt more alive than when I was with her. Imagine the most exciting woman you ever met choosing you to go with her on an extraordinary trip that lasts forever.
Must have felt pretty special. Yeah.
She could have picked anyone, but she picked me. Yeah, and now... This is probably hard for you to understand.
Actually, Tom, I know exactly where you're coming from.
Was it all a lie? I feel so stupid.
How about we focus on getting you feeling better?
Okay.
Okay.
What have you got going on tonight?
Cece got reservations at Alinea. I think I might just make it too. Any luck?
Tom has hepatitis C.
You got him to take the test.
He needed a little more time to think about what you said.
Huh.
Is this your vampire? Does that explain why you blistered in the sun?
Yes, liver failure combined with hepatitis can cause porphyria cutanea tarda. It makes it so sun exposure causes painful skin lesions. And since hepatitis is transmitted through bodily fluids, probably got it from having sex with his girlfriend.
Or from sucking her blood. Yikes.
Wait, didn't that woman bite you?
Yeah, Dr. Charles, you need to get tested.
First thing in the morning.
Hey, given the risk of transmission, you should have your blood drawn ASAP.
I mean, like right now?
Now.
You're kidding me.
Were you part of the crush? Did you get the wind knocked out of you? Is that why you passed out?
No, I got dizzy before anything happened.
And what about the vomiting?
I don't know why.
Did you buy candy? Or that horrible buttered popcorn? You know, that's not even butter.
No, I didn't eat anything.
Everywhere you go, junk food. When I was a teenager, I thought I could eat whatever I wanted. Of course, I got fat.
All right, well, your heart's regular. Your lungs are clear. How's the nausea now?
A little better, maybe. I don't know, I just always feel kind of blah.
What about that meal I packed you? Did you eat that? I make her healthy options. She won't eat them.
They're gross sides. They make me feel bad, too.
Okay, let's run some tests and see what comes back. Food allergies, infections, these could lead to extended periods of nausea. A nurse will be in to draw your blood. Give me some baseline labs, CBC, CMP, prealbumin, MAG, UA, HCG, a urine tox, and find me Dr. Charles. Thanks.
The nurse will be with you in 5 minutes.
Dr. Charles.
This poor fella in here. Agoraphobic. Picked today of all day to go to the movies.
I know you're busy. I just need a quick consult. I've got a 16-year-old patient, emaciated, persistent nausea, but her blood work's normal. No food allergies, she's not pregnant, and her mom's all over her about food. She has all the indicators of anorexia.
Eating disorder is so tricky to diagnose.
I've seen it before. My best friend in college, she was anorexic, starved herself to death. Her mom, just like this one.
Terrible disease. You pretty sure it's what we're dealing with here?
Mm-hmm.
Let's take a look.
Great, this way. Ashley, Mrs. Cole, this is Dr. Charles. I've asked him to consult.
I am so sorry about the awful day you've both been having, but Ashley, I understand you're not feeling well and haven't been for a while. Some tummy issues?
Yeah.
So you and food not on the best of terms right now?
I love food. I just can't eat it.
So why is that?
It makes me throw up.
Any food in particular, or?
Everything.
Well, that's no fun.
Makes me nervous just thinking about eating.
I don't blame you.
Are you a gastroenterologist?
No, I'm a psychiatrist.
No, this isn't that. It's her body that's in trouble.
What if I were to give Ashley something to make her not feel sick? Do you think you might be able to eat then?
I guess so.
You know, FDA has just approved a new anti-nausea drug. Remarkable results in clinical trials. You should be able to eat anything you want.
Anything. A hamburger with fries.
Yes, she can't take all that grease.
Cafeteria grill's a pretty mean burger. We could give one a try.
Sure.
Ashley.
Mrs. Cole, could I get you to go with me on this one?
Okay, yeah, I suppose.
Great. I have some samples up in my office. I'll have them sent down, and then we'll order you that burger. Nice to meet you both.
Just hang tight. Hey, what's the name of that medication?
I got a board member in my office in 5 seconds. Page me at burger time.
This is so good.
Honey, please, don't eat so fast.
Mom, I'm fine, really.
She's gonna be sick.
Here.
I knew all that grease would make her sick. So much for your magic pill.
You okay? Has it passed?
I'm sorry Ash was having such a tough time, but her response has actually told us a great deal.
I should hope so.
Dr. Charles?
Dr. Manning, be right back.
Okay, I'm gonna be okay.
What did you give her?
A Tic Tac.
A Tic Tac?
Yes.
You gave my patient a placebo?
Yep.
That's not ethical.
Oh, balls. Look, nausea No nausea. I now have a much clearer picture of what's going on. I needed to get around Mother and see that girl eat.
No, I could report you. I should report you.
Dr. Manning, you ever heard of bias confirmation?
What?
Bias confirmation. Interpreting information so that it conforms to one's preconceptions. Look, you walked in, saw a thin 16-year-old girl with an overbearing mother who reminded you of your college roommate, who very tragically died of anorexia. So voila, the patient has anorexia.
She has the indicators.
She also has the contraindicators. If the mother were that overbearing, she never would have allowed Ashley to choose that particular meal. And if Ashley were anorexic, she never would have eaten it, let alone with such gusto. The mother is right. It's Ashley's body that's in trouble, and that is your department. Thank you.
Miss Blake, I'm Dr. Choi.
Oh, thank God. Finally, a real doctor.
44-year-old female complains of lumbago. Pain 10 out of 10. HPI, symptoms
The
first
important
presented.
info. I was getting dressed for work, bent down to put on my shoes, and my back locked up.
Well, why don't we take a look? Is it okay if student Dr. McNeil examines you?
Have you done this before? Oh, wonderful.
I'll be gentle.
Guess you can't make the pain any worse. Oh! Oh! Lay on the floor for an hour hoping the pain would ease up. Nothing. Oh. Mm.
I see a surgical scar.
Discectomy.
L4, 2 years ago. Felt pretty good right after, but these days feels like a bad sneeze could paralyze me.
Unfortunately, as common as back pain is, there's not a perfect fix.
Slow, slow.
Press against my hand like a gas pedal.
It hurts. Stabbing pain. We have to do the other leg? It's gonna hurt too. So will flexion, extension, the femoral stretch, Faber test.
Been down this road a few times.
Today's the worst it's ever been, though.
What would you suggest?
CT? 5 of Valium for the spasm?
Oh, bless you. Oh.
She got on you a bit. Patients are gonna do that. Don't take it personally.
It's all good. When I was playing ball, had an OC could rip me a new one like no other. Compared to him, it was a peach.
I see the Valium's helping.
I'm trying to move around a little, loosen things up. Those my CT results?
Yes, scans show spinal degeneration and scar tissue at L3 through L5. We suspect it's chronic and not the cause of today's pain. That's likely structural, so...
You want an MRI. Compare it to the scan taken when I had surgery 2 years ago to see if anything's different.
Right. You know the drill.
Yeah, so I know an MRI won't show anything more than the CT. You'll give me some low-grade muscle relaxer, recommend physical therapy, but those meds won't do anything more than a baby aspirin. And I'm a lawyer, a partner at Astor Coldwell and Davis. I don't have time to lie on the floor doing pelvic bridges with some glorified trainer. So how about you just write me a script for what will work? Norco 10, 325s, and we can all get on with our lives.
I'll talk to the pharmacy.
I take it back. I think Nora's got the edge over my old coach. What are you doing?
Running Nora's name through the Illinois prescription database, see if she's flagged as a frequent flyer.
You think she's just trying to score pills, faking her pain?
Maybe, dodging an MRI, then immediately pressing for meds, reaching for a con job. She's not on file. Still doesn't mean we're getting the whole story.
So what do we do?
Nora had her back surgery at East Mercy. Call over there. See if she's only coming to us because they cut her off.
Dr. Choi? Just heard back from East Mercy. Nora's not on file as a frequent flyer. Never been a patient there.
Well, she definitely had a surgery. Scar on her back is clear proof.
I'll start calling other hospitals, see if she's on file somewhere else. If Nora's playing us, stands to reason she'd also lie about where she had her operation.
Maybe it's simpler than that. If I were trying to game the system, I certainly wouldn't use my real name.
So, if she's not Nora Blake, who is she?
Good question. Dr. Charles, can I ask you something? Got a strong feeling my patient gave a fake name to get a prescription.
Huh. You think we're dealing with addiction?
Likely, but I can't help her with it if I can't separate fact from fiction.
You know, often when people lie, they tend to describe things in generalities. But when they use specifics, it's more likely to tell the truth. Your patient give you any details?
Type of meds you wanted. Oh, and her job. That she's a partner at a law firm. Astor, Caldwell, and Davis.
Oh. Start there?
Thanks.
There. Nora Blake is actually Brenna McDouglas.
Gotcha.
Fine. You got me. My name's Brenna McDouglas, not Nora Blake. Can I have my prescription now?
It may feel like you need them, but more pills aren't the answer.
I'm in pain. Don't you even care?
Yes, we care, and we want to help. Let us set you up with an addiction therapist who can devise a pain management strategy that doesn't involve opioids. Here's some referrals that I think you should take a look at.
No, I don't need a therapist or a new plan. I need my refill. What is the big deal? My God, I'm a lawyer with great insurance, not some junkie off the street. Or worse, some hombre that probably can't even speak the language. That guy in the next room, Mexican or whatever, he attacked a man. He fought him right in the emergency room. But nobody gave him a hard time or prevented his care. No, the doctor, the administrator, they're bending over backwards for him. There is no way he comes before me. So give me my prescription, or so help me, I will sue you in this entire emergency room.
No.
Then get out and send me your boss.
Dr. Lennox, my patient would like a word.